Solution-focused brief therapy is, I would say, it's a vision on psychotherapy. It's more than just a method in which the problem-solving model is no longer used, but the solution-building model is used, and that's another paradigm. It's working from another paradigm, so it's a paradigm shift in psychotherapy. From finding out what's wrong with people and how to repair what's wrong, to finding out what's right with people, what does work in their lives instead of what doesn't work and needs to be changed or replaced, to what is actually working and how to build on that. That's the difference, and it is a paradigm shift in psychotherapy, but not only in psychotherapy. You see the same thing happening in coaching, in conflict management, in education, even in sports. I am a clinical psychologist, and I am also a cognitive behavioral therapist. I'm a trainer supervisor in cognitive behavioral therapy, and I have been doing traditional cognitive behavioral therapy for about 20 years, I guess, with adults, with children, with families, with couples. And after 20 years I followed a workshop in Holland by somebody, a Dutch guy who had been over to Milwaukee to work with Steve de Shazer and Inzo Kimberg, and he did a workshop in Holland, and I followed that workshop, and then I thought, I really like this. I really like this, and so I started reading about it and applying it, and later on writing about it. Yeah. And it's really energizing, because the atmosphere in conversations, when you talk about what is working instead of what isn't, and how you can build on what is working instead of repairing what isn't working, the atmosphere in the conversations it is more lighthearted and more fun. Easier and more fun. Nobody asked me my 4 basic questions myself, so that's really nice. So what my best hopes are that that the combination of solution focus and positive psychology can actually change our working field, because I think that's basically my mission, that psychotherapy, as we're talking about psychotherapy, can be better, more people can be reached, more sustainability in the gains that people make may be reached, because not everybody profits from therapy in the long run, or they fall back, you know. So I think lots of things could change for the better in making therapy better, shorter, and also more fun. And I think therapy shouldn't be the place where you only go and talk about what's wrong with you, but should always also be the place, and maybe first and foremost be the place where you come and talk about what's right with you and how you can expand on that. I think well-being for clients is of course our goal, but also for our colleagues and for professionals. I think working with a different focus, working from the different paradigm in looking at what is working and what are your strengths instead of, and resources, instead of looking at what's wrong with you, may also mean for professionals that their work is easier and more fun and less heavy on their shoulders, so the future I would like to see is a future when professionals, there's more well-being for professionals, and for instance, you could say, talking about post-traumatic success for our clients, but there's also the concept of secondary traumatization, which is when professionals they really get negatively influenced by hearing the stories and helping traumatized people. There might also be post-traumatic success for professionals. I think what's already working is that I see a shift in working from from pathology and only focusing on pathology to a shift where there's also more room for looking at strengths and resources and what is working with clients. So I see the shift in CBT, I see the shift in also of course in positive psychology and solution focus. Yeah. I think would be if there would be on one hand more research being done on this model and this paradigm change, so it becomes more evidence-based than it is at this moment, because well, that's what insurances want, and everybody wants to have evidence-based practices and randomized control trials, and so that would be a next step. Another next step would be if more professionals would actually embrace working in a solution-focused way or working with positive psychology strategies. Based on my previous book, the 1001 Solution-Focused Questions, we were talking about the feasibility of making a division, not so much, because you might say solution-focused brief therapy is a trans-diagnostic approach, which can be applied to all sorts of disorders on axis 1 and also axis 2 in the DSM-5. But then we decided to make different volumes based on the 1001 solution-focused questions, containing in each volume 101 solution-focused questions. With help, these books are meant for professionals, with help for help with anxiety, volume 1, depression, volume 2, and trauma, volume 3, and maybe later on this may be extended to more volumes, maybe, hopefully. So these volumes will be different because in Europe, and I guess it's the same over here in the US, many colleagues are working with specific client groups, for instance with trauma survivors, or for instance with depressed people. So for them, having a small volume in which they can easily read which questions to ask, because like I said, asking solution-focused questions is at the heart of solution-focused brief therapy. Might be very useful to them. For instance, if you work mainly with depressed patients or with traumatized clients, you might just select that small volume and see what questions you may use from that volume.